If you want to know what's going on inside your body, start by looking at your hands. The hands can reveal more than you think, from early arthritis to autoimmune and even skin conditions. Subtle changes in the joints, nails, or skin can often give clues to what type of disease or condition that you may have. I'm Dr. Adam Barron, a board-certified rheumatologist, and today I'll show you what your hands can tell you about arthritis, autoimmune conditions, and other health issues. Once you have arthritis, you can often see it. In osteoarthritis, firm bony bumps can appear at the ends of the fingers at the DIP joints, called Heberden's nodes. If they appear in the middle joints, called PIP joints, they're called Bouchard's nodes. These develop because the cartilage that cushions the joint has worn away, and the bone reacts by forming extra bone. This gives the fingers a knobby, uneven appearance. Osteoarthritis very commonly affects the base of the thumb. This joint at the base of the thumb, called the first CMC joint, gets a lot of wear and tear over time. When osteoarthritis hits this joint, it starts to look squared off or sunken, and there is bony enlargement there. People often notice pain when gripping or pinching, and over time the thumb loses strength and movement. If both hands have involvement of the same joints on each side and are swollen, that strongly suggests rheumatoid arthritis or another inflammatory type of arthritis. If the joint enlargement is one-sided or only a few joints are affected, it's more likely osteoarthritis. Have you wondered what is going on below the surface? X-rays act as a window showing the changes hidden inside joints. When we take an x-ray of the hands in osteoarthritis, the joint space, which is a dark line between the bones, becomes narrowed, but unevenly. That's because the cartilage that normally cushions the joint has thinned or disappeared. You'll often see new bone along the edges of the joint, called bone spurs. In rheumatoid arthritis, the joints look very different from osteoarthritis. Rheumatoid arthritis commonly affects the MCP joints, which are the joints where the fingers attach. The middle finger joints, called the PIP joints, can be affected like in osteoarthritis, but have a different appearance. Instead of being bony and solid like in osteoarthritis, they appear puffy or full from fluid inside the joint. This swelling comes from inflammation inside the joint space. The joints may feel warm and tender instead of hard, and over time the fingers can drift towards the little finger side. That sideways shift is called ulnar deviation, and it's a classic sign of rheumatoid damage to the supporting ligaments. Also, later signs of joint damage can result in a deformity called a boutonniere deformity. Another deformity is called a swan neck deformity. While osteoarthritis looks like wearing down and rebuilding with bone spurs, rheumatoid arthritis looks like erosion and destruction. Keep in mind that rheumatoid arthritis may not show x-ray changes until later on in the disease. I very often have patients who come to their follow-up appointment and have already looked at their x-ray reports. The patient says to me, "My x-rays are normal, so that means nothing's wrong," but that could be further from the truth. I tell my patients that they could still have rheumatoid arthritis because it can take over a year or several years to see joint damage on x-rays. In rheumatoid arthritis, the immune system attacks the joint lining, and over time it eats away at the edges of the bone, creating hollowed out spots called erosions. On an x-ray, they look like tiny bites taken out of the bone. The joint space may look wider early on from swelling, but eventually it collapses as cartilage is destroyed. The bones can even appear slightly shifted or misaligned because the ligaments are weakened. What else can the hands tell us? When the joints near the nails, again called the distal interphalangeal joints or DIP joints, are swollen or sometimes red, this may point towards psoriatic arthritis. Keep in mind that there is a form of psoriatic arthritis that looks just like rheumatoid arthritis. Psoriatic arthritis often coexists with psoriasis. Psoriasis patches can be seen on the hands, elbows, knees, or just about anywhere, including being hidden on the scalp or behind the ears. If the entire finger swells from the base to the tip, that's called dactylitis or sausage finger. It's typical of psoriatic arthritis or another condition called reactive arthritis, not rheumatoid arthritis. When I look closely at the nails, they can actually give away clues that someone has psoriasis and also possibly psoriatic arthritis. Psoriasis doesn't affect just the skin. It can also affect the nail bed and nail matrix. Tiny dents or pits can appear on the nail surface in psoriasis. The edges of the nails may become thickened or crumbly. Sometimes the nails lift off the skin underneath. Often these changes are confused with fungus in the nails. People who have psoriasis with nail changes are at a much higher risk of developing psoriatic arthritis compared to those with psoriasis that affects only the skin. Something else to be aware of is if the skin over the fingers looks tight, shiny, or thick, that raises concern for scleroderma. Early on in scleroderma, there is a diffuse mild swelling of all of the fingers. This is an autoimmune connective tissue disease that can affect both the skin and internal organs. The fingertips may look pinched or tapered, and it becomes difficult over time to bend the fingers. Another clue for scleroderma is having telangiectasias, and this includes being on the fingers. On the fingers, these telangiectasias are most often found on the pads of the fingertips, around the nail beds, and along the sides of the fingers. These telangiectasias form due to changes that happen to tiny blood vessels. Now let's talk about something else. If your fingers change to white, blue, or purple due to cold or stress, that could mean that you have Raynaud's phenomenon. Raynaud's phenomenon is often seen in autoimmune conditions like lupus or scleroderma. Many times Raynaud's phenomenon occurs by itself and is not associated with an autoimmune condition. Next, what if you have big hard lumps on your fingers? In gout, you may see firm lumps called tophi on the fingers or near other joints or tendons. These deposits are uric acid crystals. If you have tophi, then you've likely have had uncontrolled gout for a long time. Some people with long-standing diabetes cannot fully press their palms together, even though their joints don't seem swollen or painful. This is known as diabetic chiroarthropathy or stiff hand syndrome. It happens when high blood sugar over time causes the skin and tissues in the hands to thicken and lose flexibility. The tendons become tight, making it hard to move the fingers freely. The diabetic stiff hand syndrome doesn't just tell us about the hands. It can also be a marker of long-term diabetes control and may appear alongside other complications of diabetes that affects the eyes, kidneys, and nerves. If you recognize any of these signs in your own hands, don't ignore them. The proper diagnosis can make the difference. Your hands can tell a powerful story about what's happening inside your body. They can reveal inflammation, bone loss, autoimmune activity, and signs of other medical diseases. If you notice joint swelling in the hands, or changes in shape, skin or nail changes, or anything we've talked about, then speak to your doctor. I'm Dr. Barron. Thank you for watching. Please like and subscribe for more educational videos. This is educational information only. See you in the next video.